Fine.
Hi, how you doing? This is Dr. Federico Martinez. I'm a medical doctor. My specialty is functional medicine, and I'm so glad to be with Mia. Mia, I think she's interested in having some questions for me after my speech on functional medicine, prevention of chronic diseases and cancer.
Yes.
Mia, how are you?
I'm pretty good today. I just listened to a very informative speech, and I'm very happy to see that there are people out there who are trying to inform the most susceptible communities to chronic diseases, especially tying in both the Spanish and the English component to make sure that everybody can understand and get the care they deserve. So in my research, I've seen a lot of representation issues in healthcare in terms of who is encouraged and who is discouraged from pursuing the field. And what I'd like to ask you, as the president of the college here that's directly connected to Peru, what do you have to say to young Latinx professionals who are trying to enter healthcare?
Well, the most important thing is that we are around the world. We are, for one end, we are living with a lot of chronic diseases that represent an epidemic. As I mentioned, 70% or more of the world population suffer from chronic diseases, and most of them, they die from chronic diseases. So actually, it's an epidemic. You know, 5 years ago we were talking about pandemic, COVID, and everybody was very concerned about it, of course, because there were a lot of deaths. But the situation is not that different now. We have a lot of people, like I mentioned, with cancer. Cancer is a condition that is directly related to our lifestyle, especially nutrition. So because now we know that cancer is not a genetic disease, it's a metabolic disease. And therefore, being a metabolic disease, is related to our lifestyle, especially nutrition, exercise, sleep, stress, but nutrition is the most important one. But anyways, so the healthcare system around the world is not happy, because all they do is give you medications to suppress symptoms, but nobody really look for the root causes of the medical condition so we can eliminate those causes and actually treat the patient correctly. So I really feel that the community of students that would like to pursue any kind of specialty in healthcare, being a nurse or a doctor, or I think that they need to understand the problems that we have right now with the epidemic of chronic diseases, and unfortunately the system that is not really helping in order to take care of this epidemic. So they need to understand that there is a new way of thinking, and the medical schools also, they need to implement this type of approach of functional medicine. Some people call it integrative medicine, some people call it natural medicine. I like to call it as it is, functional medicine, because you want all of your systems to function properly.
Of course.
And when you evaluate the patient, you have to evaluate the patient as a whole, not just the symptom. Because in my practice, for example, many patients come complaining of their doctors that they have visited previously, and they say, I went to my doctor for a headache and he just gave me a pill to eliminate the pain. But he didn't bother to investigate why I have the headache. And when I investigate, for example, these type of patients, often I find that they have food sensitivity. And when you have food sensitivity, just to give an example, let's say you have food sensitivity to gluten or to milk, eggs, or whatever, that releases histamine. And the histamine produces vasodilation in your blood vessel and produce migraines. So once I find that this patient has this type of food sensitivity, I do an elimination diet for 3 months. And in that period, that patient decreases the production of histamine and the headaches disappear.
It's truly impressive how far healthcare has come in the direction. Functional medicine really is the future. And I think that that's really good advice for future health professionals. Now, kind of shifting gears here for a little bit, something that I was thinking while listening to your presentation was, wow, if I lived in America and I wasn't proficient in English, and I go to doctors and they're trying to explain these concepts to me in a language that I don't really understand, my health would be hugely impacted, and it would almost be unfair how worse off I would be compared to if I understood. So now, I think that it's amazing what you're doing, going around and speaking and combining both the languages so that it's understandable to the audience fully. How important do you think it is that we increase resources linguistically for explaining these concepts to people who may not have English as their first language?
Especially in the United States, and especially in some states like Florida, for example, or New York, or California, you need to be bilingual. Doctors need to express themselves in all of these languages. I was I'm very grateful of my parents, especially my father, and I was so blessed that I was able to learn Italian, Spanish, that's my mother tongue, and English. So it is very important that when the patient comes to the office, they appreciate so much that you are speaking to them in their language, and so that they can really, deliver whatever concerns they have about their health in the proper way. So I feel very, very blessed. But I'm also very blessed for the fact that being the president of a university, I'm in the two most important pillars of the society, which is health and education.
And you can make that impact.
Exactly. So it is really very special. I feel very special in that way, and I thank God every day for that.
I'm happy that someone like you is in charge of that position. That is incredibly moving to me. Thank you so much for taking the time to meet with me. This was incredibly informative, and we have advice and outlooks. Once again, functional medicine is the future of healthcare, and that is what we should be teaching in our curriculums. Thank you.
Thank you so much. Thank you.
Thank you.